Hello everyone, my name is Adinda Nur Faradila. I'm majoring in Nutrition Health Polytechnic Semarang. Today, I'm going to give a presentation about pineapple which is said to lower cholesterol. Huh? Seriously? How to do? Are you curious? If you're curious, let's go watch the video.
Okay, I want to presentation about lowering cholesterol with pineapples. This presentation will discuss three parts. Number one, cholesterol, which can cause various diseases. Number two, the relationship between pineapples and lowering cholesterol levels in the blood. Number three, things that need to be done to support cholesterol reduction. Next. Um, first, First, starting from introduction, cholesterol is one component of fat or lipid substance. It acts as a source of energy in our bodies. Cholesterol will be formed or synthesis in the liver. If the cholesterol level are higher, atherosclerosis will occur, which is narrowing of the blood vessels due to their present plaque that build up in the blood vessels. Therefore, we need therapy that can help lower blood cholesterol levels in is use synthetic drugs or traditional medicine. One of which is pineapples. But in addition to consume pineapple fruit, it is necessary to do a diet of unsaturated fatty acid and physical activity as a support to reduce cholesterol optimally. And then this, I want to show you a video.
Over time, plaque can narrow the artery and reduce blood flow. LDL carries cholesterol into the plaque. This is why LDL is called the bad cholesterol. A common place this plaque can build up is in your coronary arteries, which are the blood vessels that feed your heart. This plaque buildup causes coronary artery disease and increases your risk of a heart attack. Plaque buildup in other arteries, such as the carotid arteries in your neck, can reduce blood flow to your brain and increase the risk of a stroke.
The presence of cholesterol in the body can cause various kinds of disease, ranging from hypertension, stroke to coronary heart disease. Therefore, fat must be excreted through sweat and feces. If the fat is not removed and eventually accumulate in the blood, deposit will in the walls in the walls of the blood vessels, which can lead to narrowing of the arteries, the, ar- the arteries called atherosclerosis. Then, if atherosclerosis occur in the blood vessels of the heart, it will cause coronary heart disease. Besides that, if the blood vessels of the brain can cause cerebrovascular disease. One of the recommended solution is by consuming a pineapple. Okay, pineapple which is rich in fiber will stimulate the secretion of bile, and then cholesterol will come out with the bile into the intestine for further disposal. Next, topic number two, the relationship between pineapples and lowering cholesterol level in the blood. There are some people who say that pineapple can lower cholesterol level in the blood. This statement is true because pineapple has polyphenol compounds and flavonoid compounds. Flavonoid compounds can inhibit fat absorption. Flavonoid consist of myricetin in pineapples can improve lipid profiles by altering liver absorption, triglyceride assembly and secretion, and then plasma lipoprotein processing. And other exist uh, camphorol, luteolin, apigenin, quercetin, and vitamin C. Vitamin C, which can improve lipid profiles by forming bile salt, extra liver cholesterol excretion. Furthermore, polyphenols in pineapples can increase HDL levels by increasing the para-oxanase enzyme, which can increase HDL activity. Okay, we can look at the data. This data, I'll explain a little bit how cholesterol changes in the mice that were tested. There is researchers in which researchers use dyslipidemic white rat with the result stating that at the dose of pineapple extract 3 grams per head in group 3 had shown a decrease in LDL cholesterol level and was significant different from the dose 3.5 in group 4 and a dose of 4 gram in group 5. Then in group 5 with a dose of 4 grams per head, the large decrease was 36.90 milligrams per gl. Okay, and it almost matched the LDL cholesterol level in the normal white rat group, namely 15.6 milligram per gl. So you can see that the reduction in cholesterol is very significant at the 4 grams dose. Next, can be seen this diagram, then get a correlation test that is directly proportional to HDL, namely the increase in the dose of pineapple extract can cause an increased HDL in mice with the most effect dose in this study is 4 grams per 200 gram weight per day. That is 74.34 milligrams per dl and almost the same as HDL in mice group 1. Next, thus it can be conclude that the content in pineapples is very effective in reduction cholesterol levels in the blood. Apart from its contents, pineapples are also high in fiber, so that they can increase bile excretion, which result in a reduce enteropathic cycle. The reduction in the enteropathic cycle will make make the cholesterol that dissolves in bile a lot, remove, and the amount of cholesterol in the body becomes much reduced. Next, topic 3, things that need to be done to support cholesterol reduction. Cholesterol reduction is not enough by consuming pineapple alone, but must be balanced with a diet. One diet, uh, one diet that can be used to lower LDL cholesterol is a diet unsaturated fatty acid, such as MUBA and PUFA. Consumption of omega-3 PUFAs, omega-6 PUFAs, and MUFAs is associated with an increase in HDL cholesterol concentration by up to 5% and a decrease in triglyceride by 10 to 15%. And then physical activity, uh, the American College of Sport uh, Medicine uh, recommend that a person participate in aerobic exercise activity at least 3 times a week for 20, 20 to 60 minutes. Aerobic exercise can reduce the triglyceride concentration by um, to 20% and increase the concentration of HDL cholesterol by 10%. Doing uh, 60 minutes of aerobic exercise 3 times a week for 8 weeks can lose weight 2.5 kilograms. Next, my summary: cholesterol treatment with traditional medicine, namely pineapples, extract at a dose of 4 grams per 200 grams weight per day will cause an increase in HDL in mice, and by dieting with unsaturated fatty acids such as MUBA and PUFA due to dietary factors. The most influential in increasing the concentration of LDL cholesterol is saturated fatty acids, then with physical activity such as aerobic exercise or endurance exercise can reduce triglyceride concentration and increase HDL concentration. Okay, thank you, and don't forget wear a mask when leave the house at home, and then keep a distance from other people, and then always wash your hand with soap. Thank you. Bye.